Hey everybody, so once again, we're updating on some COVID stuff. A lot going on, a lot of changes. This time it's going to be about procedurally. How do we BVM these patients? How do we keep ourselves safe? We got some new equipment coming out, new things, and some old things mixing together. So how do we make all that work? You're like, well, it's no different. It's the same thing, right? We're just BVMing patients. Well, we've added some stuff. You may have seen these guys. These are the antiviral filters that we're going to be adding into the equation. We pushed out some filters the other day that we had left over from old vent kits. Unfortunately, we're going to be pulling those back. They had little adapters. We don't need any adapters with these. These work in line. They're the right size and everything, and they're antiviral. So these are going to be our go-to use. So we're going to have these, and we're going to talk about BVMing a patient first, and then we'll talk about an intubated patient. But we're going to have our PEEP valve, something you guys know about. We're going to have end-tidal, and then we have our BVM, right? So your BVM's normal setup, we're like this. We got to add some stuff to this, right? So we're going to have our PEEP valve over here on the side, like usual, so we can dial in PEEP. But we got to do some other things. So next thing is going to be, we want to make sure our end-tidal is to the patient. So that's going to go to the patient side, which is going to be the mask side. We want to make sure anytime we're doing end-tidal, it should be as close to the patient as possible to get that accurate reading. Then we have our antiviral filter. So this BVM situation on a COVID patient is going to look a lot like this. We have mask, end-tidal, close to the patient, antiviral filter, and then we have PEEP up here off the side. Remember, this is the clean air coming in, so anything that's blown off with the PEEP valve, it's okay because it's the clean air coming in. Anything that's exhaled is going through this antiviral filter, making sure we're not getting COVID coming out, okay? Make sure your pop-off valve is all the way closed on this BVM. If it's open, we're never going to get up to the PEEP, the desired PEEP. So make sure that guy is closed and you'll be set. Looks like a funny contraption, but that's how it's going to work for any COVID patient. We're going to have mask, end-tidal, antiviral filter, BVM with PEEP. Okay, so let's say we intubate the patient. We've got some new contraptions for that side of things too. So I'll set this aside for a second. I'm sure you've seen these coming out of the hospital before. This is inline suctioning. Okay, we probably should have had inline suctioning a long time ago, but we added inline suctioning to our equation. And so we're going to add this in. So we have the patient intubated. Okay, now we need some inline suctioning. So we're going to put this into the equation and go from there, all right? So this looks a little different than we're probably used to. Same setup. Before we go, I'm going to adjust some things here. We're going to need our end-tidal and our antiviral filter. Remember, end-tidal goes to the patient. We're going to have our inline suctioning here, and it's going to be a little bit different than what we're used to as well. So you cannot have you want your suction hooked up there. Here you cannot have the end-tidal in between. This suction needs to go straight down the tube. Don't try to put your end-tidal in between. It's not going to work out. Make sure that looks just like that. Suction straight down the tube. Over here, we're going to have our antiviral filter and our capnography tied in right here, okay? So we have capnography first, antiviral filter, and then way out here, we're going to get to the point, move that so you can see it. We're going to get to the point where we are now have our ventilator tubing. So we have vent tubing coming in, antiviral filter, capnography, suction device, inline suctioning. If you're not planning on using suctioning, I would still have this in there because you never know when you're going to have to use suctioning. Real important part, this suctioning only works with 6O tubes and above. If it's too small, it won't feed in. Sometimes when you try to feed it in, it kind of locks up here at the top of the tube and you just kind of have to twist it or wiggle it and then it goes in, okay? Questions, can you go all the way down? You can. Remember, we only suction on the way out, so you can feed that all the way down in there. You might hit the carina. If you hit the carina, that's fine. Stop. If your right main stem, this is a plastic soft tube. Shouldn't hurt anything. We only suction on the way out. How do we suction? We hook this thing up to suction. When we're suctioning, we push in and we pull out, okay? And that's going to get all that nasty out. Make sure you're pulling from the end. Very, very important. When you pull it all the way up. If you leave this suction block in the tube, it's going to have problems. You can actually feel it kind of, when I get to right here, it kind of pops up, okay? When it's all the way up, it pops up. I don't know if you can see that right there. I'll try to do it again real slow. See the tip? When the tip's down too far, it can block our tubing. So make sure you pull it all the way up, and then you can see it come right through there, and it pops up to where it's supposed to be, and it'll pretty much stay where it needs to be, out of the way. This is a closed line, so we shouldn't have any problems there. Biggest thing is guys, I know this looks funny. We're adding a lot here. Make sure your tube's well secured. But you have your vent tubing, you have your antiviral filter, you have your end tidal, and then you have your suction line, okay? Suction and tube. Make sure this tube's well secured. Make sure you have your mask on. Just because we're adding this antiviral filter, you still need to have all your precautions on, okay? This should be on any suspected COVID patient we have to intubate. We're going to utilize this, okay? I'm sure we'll be rolling out more stuff. I just wanted to get you this information. There's a lot going on. You can ask me questions, call me, whatever you need to do, and we will get you the information.